Hi, I'm Dr. Melodie Zamora. I am a board-certified obstetrician gynecologist, and I'm currently working at Innovative Women's OBGYN. Breast cancer screening is recommended by gynecologists to start as early as age 40 if you have no significant family history of a first-degree relative. We do recommend that patients get those mammograms or screenings done at age 40 and yearly at every annual exam that they show up for us. Now, there are other ways of kind of breast cancer screening per se. You can do clinical breast exams at home. Those we recommended as early as your 20s for sure. When you're coming in for exams, we will do a clinical breast exam, but we do recommend that some patients can do them at home as well. And they can do that on a monthly basis, if they need to. They tend to know their breast tissue more than we do. We see them once a year, and they can frequently do those palpations and identify if they feel like there's an abnormality or breast pain. And that is kind of where you start off before you start getting into the imaging modalities such as mammograms or ultrasounds. Now, a lot of people wonder about the different types of imaging and which ones they can choose. There are women who do mammograms and are not very fond of the pressure that gets pressed on their breast tissue, and so they can be uncomfortable, and so they ask, can I do something else? The mammogram is the standard of care. Ultrasounds may be done additionally, depending on the density of the woman's breast as well. People do ask about MRIs. That kind of also falls under its own little subset in terms of who is an appropriate candidate for those. Usually those are kind of patients who are getting followed for breast cancer, but the standard would be, again, your mammogram plus or minus that ultrasound on a yearly basis. Now, if we find something or notice an abnormality, well, then that interval is going to be much shorter. Most of the time, if we're kind of just suspicious of something, then that might be an every 6-month interval imaging to ensure that there is stability in whatever abnormality we may have seen. So there's different types of categories on how you say whether a mammogram is normal, highly suspicious, severely suspicious, thinking that there is a malignancy. And so given those results is how we identify what patients might need to have screening a little bit sooner or not. Now, that is just a standard patient. If you have family history, for example, we want those patients to get screened approximately 10 years before that family member was diagnosed. So let's say that my mother was diagnosed at age 40. That means that I should at least start my screening at age 30, as opposed to the 40-year mark that I had mentioned that, general screening is recommended. In addition to that, there are obviously hereditary breast cancers. And so we do offer or recommend to those patients, if their family members have not done so, genetic screening. Because if you do have a high risk for hereditary cancer, for hereditary breast cancer, then the screening is going to be completely different. The one that most people know about is the BRCA gene, or BRCA, BRCA1, BRCA2. And so those, if you have that gene, then your screening actually starts very early, 25. We start doing interchangeable MRIs with mammograms, meaning every 6 months you're kind of changing into those things, because it increases the risk of breast cancer up to about 70% for patients. And then the risk of ovarian cancer is also associated with that. So we also do interval imaging as well as blood work to assess, is there some abnormality with their ovaries that we can see in those types of testing. So part of the well woman exam is to ensure that we get a full detailed family history so that we know what is the best imaging or recommendations that specific patient should get.